talking about OPD patients, what are sort of your red flags to see in a patient? What sort of symptoms or signs as to say will tell you that this guy is potentially a sleep apneic and is not breathing properly at night?
I'll tell you very simple.
Yeah.
If you get a guy who, despite sleeping 7-8 hours, not feeling fresh, and even has the mildest form of snoring, that's the patient that will benefit maximally.
Mm-hmm.
Okay, so that is a patient we should never miss out. That doc, even on the weekdays, so I don't get sleep only. I get only 6 hours. But even on the weekend, despite getting an 8-hour sleep, when I get up in the morning, I'm not feeling fresh. This is your 35, 40-year-old guy, may or may not be obese, may not be snoring very loudly, maybe having a very mild snore. But that is one person that I would like to treat. Very common in kids to look for signs of, I would say, restless sleep. If I see a kid who's, instead of sleeping like a log, kids should sleep like a log. Like if I see my daughter, once she falls asleep, the first hour I cannot shake her up. You can put on all the music and she's fast asleep. She's not moving around.
Kumbhkarna jaisa.
Absolutely. That is how it should be. Okay? But when your kid is struggling to find the right position in the bed, struggling to, positioning the head in a certain way, rotating the head in a certain way, and trying to open up the breathing passage, so to say, that's a red flag for me. Other things would be like daytime symptoms, like energy levels is another sign where by the afternoon or late in the evening you start feeling exhausted. There could be other factors too that can cause this. And also the fact that when you wake up in the morning, you rush for a glass of water, dry mouth. That indicates that you are breathing through your mouth throughout the night. So those are the typical signs, simple signs that people can look out for themselves. They don't need a doctor to ask them.
What about a neurologist OPD? What sort of symptoms you get and then you think about sleep apnea, that possibly this patient has a snoring disorder?
So disturbed sleep could lead to a whole variety of cases, and a lot of them could end up with a neurologist. So the highest likelihood one would be migraine.
Okay.
So anybody with migraine, I ask for sleep, I ask for snoring, because poor sleep leads to autonomic dysregulation, which means that the nerves in your brain are unable to regulate themselves. So whenever there's excess stress, that could be in the form of excess light, excess sound, irritability, excess just taking tension over some household event, they are not able to regulate themselves, and that dysregulation comes out as pain. So that is one of the core pathophysiology of migraine.
Early morning headaches,
yes. Right. So these are very characteristic of disturbed sleep. What we already covered, mental health. So anxiety and depression often coexisting with migraine, with the underlying cause being poor sleep. So wahan pe you should definitely ask for this. People having sexual problems. So erectile dysfunction or premature ejaculation. Again, because of autonomic dysregulation, which can be because of poor sleep. And those patients also sometimes come to a neurologist. People with other somatiform illnesses, so chronic fatigue syndrome, fibromyalgia,
absolutely,
body aches, unexplained pains. People with back pains, they will go get an MRI, there'll be a slight disc bulge.
They would blame it on that bulge.
Yes, and then somebody will say, tumko operation karna padega. But you know that that's not the reason why. And just fixing their sleep with some mild physiotherapy and they are fine. So in these cases, asking for sleep apnea, asking for disturbed sleep, very important. Can save lives, can save them a lot of money, save them from unnecessary surgeries. So yes, these are the cases I would ask for.
One thing is, patients, are very educated, but in the case of sleep apnea, they'll not come and say they have sleep apnea. They'll not come and say that they have snoring. They will not correlate snoring with their not feeling fresh in the morning, because they may be snoring for a long period of time. The body was compensating, and the lack of feeling fresh or the non-refreshing sleep may be a recent phenomenon.
Yeah.
So it is for us to figure out, like, typically if I get a couple in their 40s and the guy is not feeling fresh getting up in the morning, they've been married for 15 years, he's snoring to glory for 15 years. But that freshness issues, the tiredness issues, the falling asleep during meetings issues has started in the last 2 years.
Yeah.
So how do you expect that guy to correlate snoring with that?
Right.
Because he's been snoring forever, right?
Yeah.
So it's very important for us to scratch the surface. Very important for us to ask for it.
Yeah.
And I mean, it's very common. It's highly prevalent. So you will never go wrong.
So talking about prevalence of sleep-related breathing disorders, especially obstructive sleep apnea, one of our AIM study told us that about 11 to 15% of Indians are suffering from it. And so many of them are kids. So coming to kids, what sort of symptoms or what sort of signs do the parents tell you that this particular boy or girl is suffering from breathing issues at night? What makes you think that this patient requires my help?
So upfront, the easiest symptoms to point out is snoring and mouth breathing at night.
Yeah.
So that's the simple ones to pick up. These kids may have grinding of teeth intermittently. They may have bedwetting issues.
Yeah.
They are generally very restless sleepers. Another symptom that we look for is the posture in which the child is sitting when the child is coming to our clinic. So typically they will have a forward neck posture and they will be like, they will always be sitting in front of us. And essentially what they are having is a bad nose block for which they are not complaining. Because the block is in the backside of the nose, it's not that symptomatic during the day.
Yeah.
The child has
Body
adapted
compensates
to, yes,
for
the
that
child
block.
has adapted, because that's what children do. They don't complain, they adapt. We don't want them to adapt, but they adapt to mouth breathing.
Yeah.
So those are the typical things that we look for.